We're talking about pelvic pain. If you have questions, you can send them to the doctors at WLBT.com. Joining us now is Dr. Paul Moore at Baptist Medical Center, and he is with Southeast Urogynecology, which means I guess you're a combo gynecologist, urologist.
And our subspecialty mainly deals in treating problems of urinary incontinence and pelvic organ prolapse. And so that's kind of the main things that we do.
Tell us about pelvic pain. What are the causes of pelvic pain?
There can be many different causes, and that's part of the problem, is trying to figure that out. It can be from muscle problems, nerve problems. It can relate to the bladder or the GI system.
So obviously this is a sensitive topic for our viewers, so if you think that you've got some small children in the room, or maybe you may be offended, you can go ahead and change the channel real quick, come back to us in a couple of minutes. Something else that I'm hearing more about is a vulvar pain. What is that? Well,
the vulva is the area of the skin around the opening of the vagina, and women can have problems there as well that can be either from skin disorders or, again, nerve pain or muscle dysfunction that lead to chronic pain or just intermittent pain, sometimes just at the time of intercourse.
You know, I don't understand what causes all these problems.
Well, we don't always know why. Sometimes it's a result of injury. Sometimes it's a result of autoimmune skin disorders. Sometimes it can be from previous surgery and scar tissue. We just don't always know, but part of what we try to do is figure out why, so we can get a better treatment.
Are women shy about coming in to be treated for pelvic pain?
I don't think so. I think most people, they'll reach a point where it's impacting their life enough to where they'll make their way to their doctor.
And apparently it seems like more and more people are willing to talk about it. I don't remember hearing about this years ago.
No, I think more people are realizing that that there are things that can be done, and that talking about it and really focusing in on what specific symptoms they may be having can help find a treatment to improve their quality of life.
And well, what kind of treatments are available? I mean, are there some simple things, or is it really just a process?
Oftentimes it ends up being a process, because at least by the time they've made it to me, they've tried some of the more basic things, whether it's hormone medications or like birth control pills if it's a GYN problem, or antibiotics if it's thought to be UTI related. But some of the things that I will often think about are, there's certain medications for muscles or nerves that can be used. There can be, and those can be taken by mouth, or they can be made into topical creams that can be applied. Sometimes medications are put into the bladder if the bladder is thought to be a problem, and occasionally surgery will be offered.
And so, of course, that's probably the last thing you want to do is surgery, but...
Yeah, because some people don't want to do the surgery. They want to know if there's other things that they can do.
And usually there is, and surgery can often be more or less a last resort, or if it can't be figured out any other way, unless there's some specific compelling reason to do it.
Okay.
All right.
Great information.
Dr. Paul Moore, who is with Southeast Urogynecology, and that's over at Baptist Medical Center. We thank you for joining us. Thank you for that great information.
Oh, well, thank you so much.
And for the latest health news, you can log on to our website, WLBT.com. That'll take you to our real news website, MSNewsNow.com. Just click on Medical Matters.